Welcome to Health and Wellness. I'm Dr. Jennifer Ashton. Today we are in the shoe department of Saks Fifth Avenue in New York City, one of my favorite places, talking about foot problems with New York City podiatrist Dr. Dan Gellar.
With a higher heeled shoe, you want to make sure you give yourself a little bit more forefoot room. In New York City, fashion is king. To try to tell women not to wear these beautiful fashionable shoes is a little bit crazy.
Falls on deaf ears.
It definitely does. When we see a shoe that perhaps has a heel of 2.7 inches or higher, it affects our gait. It puts pressure in areas that we don't necessarily need it, most notably our knees. We start to increase the pressure in our knees by 26%. When we put more pressure on our knees, we start to increase the likelihood of injury occurring. Plantar fasciitis is very common, especially in New York City, especially in women, especially in runners. So you could take a shoe perhaps that something like this, as wonderful as a flat may be, where women may wear this to and from work or practice in the workplace, and then go to a shoe like this, where it's a very high heel. So essentially what you're doing is when you're going from a shoe from here to here, you're altering the mechanics about the foot. So the plantar fascia is a broad-based ligament that runs from the inferior surface of the heel bone up through the base of the foot, up where the metatarsals are. So essentially what happens is the toes. And essentially what happens is the plantar fascia gets stretched or it gets inflamed, and it causes a lot of pain. The pain could happen in the mid-arch, or it could happen more in the insertion of the arch. And that has the added benefit of pulling on your heel bone, and the bone becomes inflamed.
What is the treatment for plantar fasciitis?
Treatment for plantar fasciitis is once again evaluating the foot, evaluating the leg, taking an assessment of why it's happened. Basically, we start with very conservative measures. We'll start with stretching, which is stretching the calf muscles, stretching the plantar fascia muscles, the foot muscles. There's icing, which we try to encourage people to do 10 to 15 minutes a few times a day. There are anti-inflammatory medications that can help reduce some of that local inflammation, and then getting them into proper shoes, proper arch support if need be.
But it sounds like the most important thing is to really treat the problem that caused it, not just the symptoms that result from it.
This is true. There is a root cause.
What types of foot problems does obesity or even a little bit of excess weight, what can it do to the foot?
Yeah, you're putting a lot of pressure on the joints. You're putting a lot of pressure on your lower back, your hips, your ankles, your knees, your feet. So it's just a lot more pressure. So getting down to an ideal weight is very important for people to essentially avoid injury, or at least help prevent injury.
We're going to have more about foot health and podiatry from our guest expert, Dr. Dan Gellar, after a word from our sponsors. Stay with us. We are going to now take a walk around this incredible shoe department at Saks Fifth Avenue in New York City. And you, Dr. Gellar, are going to rate my dream shoe choices in terms of how healthy or not healthy you think they are, strictly from a podiatry standpoint. I will rate them from a fashion standpoint. I just wanted your one-liner on a grade, if you will, of, let's say, the wedge.
The one nice part about it, it does increase the base, which gives a little bit more
stability.
A little more stability.
So this shoe is actually good for your health. I love it. Okay.
This will put some stress on the back of the leg and the Achilles tendon. But overall, it's got a wider forefoot. It's got that little peep toe here, so the toes can't come out. They're not going to be scrunched. They're not going to sort of contract up on us. It does look like it has a little ankle support, which I don't think is the goal of the designer. It's a nice looking shoe. It just looks like the heel might be high. The heel is a little bit narrow, so it's probably a little bit unstable. So as you say, the novice high heel wearer might want to practice around the house a little bit before getting out in this. Just be careful that the shoe is not too short.
Got it. So maybe go a little size up.
I would go a half size up to a full size up, just so you get a little more space in the forefoot, so you're not crunching in through here, putting any excess stress on the toes.
I am a boot addict. I love boots. Are these good for your feet?
Riding boots are wonderful. And if you notice about a riding boot, it does have a little bit of a heel lifting back through here. The sole is rather rigid, so you don't get a whole lot of motion in the arch, which is good for support and for stability. And they do come in widths, and this is it's not going to be too narrow in the forefoot. It's going to lend a little bit of stability in the ankle and the leg. So I think overall a riding boot like this is a good choice.
Another work of art. Look at this, beautiful high heel kind of clog.
It's got a nice high heel, but when you look at the high heel to the front ratio here, which is the platform in the front, it does essentially not bring your forefoot all the way down to the pavement. So it does in fact lift you up a little bit. So it does take probably about an inch and a half off the heel. So
Which
a shoe
is
like
really interesting.
this
Most
is great.
people don't realize that. They just look at the heel. The platform actually makes the heel shorter.
That's right. So this works for women all around because it's a fashionable shoe. Your calf or your heel is not as high up so you're not going to get that contracture in there. You're not going to put extra force on your forefoot. So this is a good choice. So it's deceiving, but it's a good choice.
And it has some support, so you're not going to fly out of it.
This is true.
Okay.
Women in New York City have the tendency to want to wear their shoes and walk around the city all day long. And I just say, a shoe like this, you might just want to limit that. Of course, you want to get good shoe time in there, but you want to realize that there is no heel lift, there is no arch support. Which happen is with this little fabric that goes between the first and the second toe, there's nothing else stabilizing your forefoot, so your toes want to grab.
Right.
And when they start to grab, you just sort of cause some imbalances in the tendons, which could ultimately end up it will end you up with hammer toes.
So in limited quantities in terms of time, a shoe like this is fine, but not if you're sightseeing around a city or on your feet all day.
That's right.
Thanks for joining us for another episode of Health and Wellness. I'm Dr. Jennifer Ashton. Until next time, wishing you good health.